Welcome to the Better Man Clinics, the podcast where we talk to actual experts to address the questions that men want answered, but are either too embarrassed to ask or simply don't know who to ask. Before we get started, I do want to caution that the conversations on this podcast are for informational purposes only. They don't represent a medical consultation, nor do they present medical advice. Rather, we hope that the podcast empowers men with the knowledge and the confidence to address their issues with their healthcare providers. As with any medical or wellness issues, you should always consult with your healthcare provider before beginning any type of treatment or preventative intervention. With that being said, in today's episode, we discuss wrinkles. That's right, wrinkles. A topic not too many men talk about, but one that a lot of men think about. How do we know this? Well, a recent study was conducted about the use of Botox, one of the most common treatments for wrinkles. That study found that in 2019, men underwent nearly 500,000 Botox injections in the United States alone. That was nearly a 400% increase as compared to the year 2000. So while many men may not openly talk about their wrinkles, they certainly appear to be thinking about them. Joining us today to help us better understand the causes and management of wrinkles is Dr. Jasmine Yun. Dr. Yun is a board-certified and licensed dermatologist who earned her undergraduate degree from UCLA. She then received a joint MD MBA degree from the UCLA School of Medicine and the Anderson School of Management at UCLA. She proceeded to complete her dermatology residency at MLK Harbor and Harbor UCLA, and then completed a dermatopathology fellowship at the Ackerman Academy of Dermatopathology in New York. Dr. Yun currently serves as a clinical associate professor of dermatology at the USC Keck School of Medicine, where she's devoted much time educating resident physicians and also has spent time participating in medical missions to developing countries. She also has a private dermatology practice in Los Angeles. And with that, I bring you our conversation about wrinkles with Dr. Jasmine Yun. To the Better Man Clinics. Today, we're going to be talking about wrinkles, an issue that most guys won't openly talk about, but many of them are really thinking about. And how do we know that? Well, to give you one example, a year or two ago, a study was done which demonstrated that most guys, again, who don't think about wrinkles, still get treated for them, or at least many guys do. This study showed that about 500,000 men in the United States alone underwent one of the most common treatment for wrinkles, Botox. And that was a 400% increase since the year 2000. So while guys might not be thinking about wrinkles or talking about wrinkles, I should say, they're obviously thinking about them and they're obviously seeking help for them. So today we're really fortunate to be joined by an expert on wrinkles, a board certified and licensed dermatologist who treats men and women for wrinkles every day. Dr. Jasmine Yun. Dr. Yun, welcome to the program.
Hi, Dr. Schwartz. Thanks for having me.
Absolutely. Absolutely. We're very lucky to have you because, again, this is a question that I know that a lot of guys want answered every time they look in the mirror and they start thinking, that wasn't there yesterday. What do I do about this? How do I start looking younger again? So the first question I have for you is really just in terms of your own experience as a dermatologist. You, as I mentioned, I'm sure you see a lot of patients seeking help for the management of their wrinkles. Just on off the back of the envelope calculation, what fraction of those patients are men?
I would say, I've been practicing for 21 years now, and every year the percentage grows. Wives are bringing their husbands into the office and they're both getting Botox together. I would say over the last 5 years, the percentage has grown from 10% to 20% of my patients who are men seeking treatments for cosmetic reasons, such as wrinkles, brown spots, saggy skin. So it definitely has grown.
Well, that's awesome. That's awesome. There's no reason why guys should kind of be sitting in the shadows, kind of, being embarrassed about this. There's nothing to be embarrassed about. And it's funny because every doctor I have on the program, they start off with the same comment, and their wives or partners bring them in. Is always the comment I hear. It's never they walk in by themselves. They mostly get dragged in by somebody, some loved one who says, you know what, you could use a little bit of help. So thank goodness for them, right? That's for sure. And specifically from the wrinkles perspective, like what age would you say your typical male patient is that comes in for wrinkles? Just to give us a baseline understanding.
Well, the range would probably be from 20 to our baby boomers in the 70s. But the average is probably the Gen X generation, 30s to 50s. And now we have social media. So
Yes.
we have a lot of patients who are young, who are interested in prejuvenation, which means the prevention of wrinkles. And then our Gen Xers who are just starting to show the visible signs of aging. And my practice is in Studio City, named after all the studios in proximity to our practice. So we have a lot of celebrities, actors, and people behind the cameras, the crew, the directors, the cameramen who want to come in and just get a little zhuzh, nothing, not a facelift, not anything anyone would say, hey, you had something done. You just look a little bit more relaxed and rested.
Did you say zhuzh?
Yeah, a little zhuzh on the face.
I
Nothing
love
big.
that. I got to start using that zhuzh. I love it.
Yeah, not
I
a
love it.
facelift, just a zhuzh.
As from the urology standpoint, we never have zhuzh, so it's always good to hear how the other half lives. That's for sure. So let's take a step back, just and everybody knows what a wrinkle looks like. Obviously, I can show you lots of pictures. I mean, everyone knows what it looks like. But the one question that they may not have an answer to is, what is a wrinkle? Like, what is it actually in medical terms?
So a rhytid is the medical term for a wrinkle. So over time, natural aging and other factors may be part of the aging process. Under the microscope, because I'm a pathologist, I read slides and I see the skin under the microscope. There's less collagen and less elastin in our dermis. So the building blocks of our skin, the foundation is our collagen and the elastin, which makes it kind of bounce back. The collagen and elastin over time weakens, and that begins to let the skin sag and get thin. And that's when you start to have fine wrinkles. When you start to make expressions over time, like frowning or smiling or smoking or puckering, those are dynamic wrinkles, which means that your muscles are moving a lot and you start to have those deep wrinkles in the frown lines, the smoker's lines, and the crow's feet from smiling. And those are different types of wrinkles that we can have over time. And the deeper that they get, it's harder to chase them. Say if you're, wake up and you're 80 years old and you realize that you have all these deep lines, it's harder for me to reverse them than if you start at a younger age, like 30, 20, 30, for prevention of those wrinkles.
That's interesting. So it does, you hear out in the media a lot of criticism for younger people getting treatment, various treatments for wrinkles. Oh, you're too young for that. Like, what do you need the wrinkle treatment for? But what you're saying is, if I'm catching you correctly, is if the sooner you start some kind of intervention, or if you say prevention, the better success you'll have in the longer term. So if you're waiting truly till you're late middle age and those wrinkles are quite obvious, they're harder to reverse. So you're probably going to have less success. Is that correct?
Exactly. And the younger that you start in prevention, the fewer treatments you'll need per year, because you'll still be able to emote and have facial expressions, but you won't have those deep furrows and lines that are hard to reverse.
Got it. So in terms of, you had mentioned some causes that I want to dive into a little bit. You're not going to reverse the ability to age, although I'm trying really hard. And there's some really actually interesting research about that, but we won't go into that. It's for another podcast. But let's assume we're all aging. We're not going to reverse that for sure. One thing you mentioned was smoking, and you specifically mentioned smoking in terms of, I guess, how you're puckering on the cigarette. But does the cigarette smoke itself, or the chemicals in it, also cause wrinkles, or is it just the process of kind of puckering around a cigarette that causes it?
Yeah, when you smoke, obviously you have the puckered lines, but also you have less oxygen to your skin. And when you have less oxygen to your skin, your skin is always repairing. Our skin is, now one of the largest organs in our body. Now the interstitium is a large organ too.
Right.
But we're always trying to repair the DNA damage of aging, natural aging. And if you deliver less oxygen to our major tissues, it can increase the free radicals and the toxins that build up in our skin. And so that increases premature aging and the signs of aging. So definitely important to stop smoking cessation, obviously for the puckering, and also for the decrease of the DNA mutations in our skin. You want a lot of oxygen going to your major organs, obviously.
Generally a good rule
Your
of thumb.
skin, yeah, good for your heart, good for your lungs, good for your skin.
That's
To
awesome. Well,
stop
that's
smoking.
always a good rule of thumb, right? And
Yeah.
then what about the other thing that we hear about? I always think about that movie. There's something about Mary with her friend that does all of the sun tanning, and she's kind of looks a little bit like a prune like afterwards. I know that was a little bit of hyperbole, but how much does sun exposure, especially for us sun worshipers in California, how much does that impact wrinkles, or does it?
Oh, definitely. The literature shows that UV rays increase DNA mutations. So obviously that's what causes skin cancer. And it also increases the sign of wrinkles and aging. So I always tell my patients in Los Angeles, it's obviously you want to enjoy your life, you want to have an active lifestyle, but cover up, wear big hats, try to avoid sunbathing at all costs. Obviously, no tanning salons, and then avoid being outside between 10 a.m. to 2 p.m.
Got
because
it.
that definitely increases your risk of skin cancer and premature signs of aging like wrinkles.
And one thing that I've heard about in terms of, the risk of skin cancer or whatnot, with the fairer people, lighter skinned people having higher risk, or at least that's what I've heard. I mean, I'm not going to put words in your mouth for sure. Please correct me if I'm wrong. Is it the same thing for wrinkles? Do people with different skin tones have different propensity for wrinkling based on UV exposure?
Yes, I mean, genetics, race, that definitely has an effect on obviously the risk of skin cancer. Fairer individuals have an increased risk because the melanin in brown and black folk is protective. Under the microscope, even we can see that the solar damage is increased in patients with fair skin who have had a lot of sun exposure. And then patients with brown or black skin have decreased sun damage under the microscope. So, and that relates to wrinkles too. A lot of Asians, Latinos, and Blacks have fewer wrinkles. They have other problems in terms of having coarse or curly hair issues, but in terms of wrinkles, they're more spared than the fairer individuals.
Got it. Got it. So, by the way, anything else? Are those the biggies in terms of things, I should say, causes that at least are to some extent can be avoided? Anything else that comes to mind that we didn't cover?
I think just smoking cessation, sun protection, sun avoidance would be the major two. That's what I really try to tell my patients that I'm doing any kind of cosmetic treatment on. You don't want to waste your time and money on treatments when you're just making more wrinkles. So I always, and a lot of the procedures that we do perform, I do want them to stay out of the sun for about a month afterward, because you can have hyperpigmentation, scarring from the sun.
Got it. It's very helpful. Now, one thing this term I love that you just used earlier was in terms of prevention. You called it, I think, prejuvenation. So kind of prevention even before you start seeing wrinkles. So I'm curious to know what that entails. I mean, we're going to be talking about actual treatment a little bit later, but how can you prevent, if you're a young person, how can you prevent? We talked about sun exposure. We talked about avoiding cigarette smoking, et cetera. What other things do you recommend to patients to, if you will, prejuvenate?
Yeah, so our 20-year-olds, our 30-year-olds are coming in for the social media term prejuvenation, which means obviously prevention. And what you can do, you can get over-the-counter items, the creams, topicals, and those are obviously non-invasive, easy to acquire. You can just go to your regular corporate pharmacies, like CVS or Target, and get these great creams. I would say in the morning, you can start off with a vitamin C serum that seems to be shown to decrease the free radicals and all the pollution in our cities, the sun exposure that we have. It can decrease that the oxidative damage from just being alive in the world today. So I would put that on clean skin, a vitamin C serum over the counter. Any brand is usually good. And then I would do sunscreen, at least SPF 30 in the morning. It's just a great habit to get into for men and for women. I know a lot of men have an aversion to putting anything greasy or anything on their skin. They just want to brush their teeth, shave, and go. Exactly. But it's always good to get in the habit of putting the vitamin C serum, then the sunscreen, and then you don't have to worry about the sun. I mean, obviously, if you're outside swimming or sweating, reapply after an hour if you've been swimming or sweating, and then reapply midday if you've been outside. And if you're outside, wear a big hat. Okay, so that's in the morning or during the day. And then at night, you can get an over-the-counter retinol. And a Retin-A, basically, the prescription retin is tretinoin, Retin-A, Tazorac, tazarotene, a different adapalene. These are all Retin-As. Some of them are over the counter, some of them require a prescription from a physician. But what they do is they work in a couple different ways. So Retin-As at night, when you use them over time, first they'll take off that dead flaky skin on the outside. So you'll have like a little mini peel. So then after maybe a couple weeks, the dead flaky skin is off and it's promoting differentiation of your skin. So it's turning over a little bit more quickly, so you have more of a glow. Mm-hmm. And then over months to years, if you've been using Retin-A, it promotes collagen building. So what we talked about, the building blocks of our skin, our epidermis, is the collagen. So it promotes a good foundation for your skin. So it helps tighten and prevent saggy skin. So I always recommend those three things for every patient, 20s and up. Vitamin C serum in the morning, which is the antioxidant, sunscreen after that, and then at night a retinol or Retin-A.
Got it. So it's kind of like the three foundational pillars. It helps you avoid the sun damage, helps you avoid the antioxidants, help you avoid all that oxidative stress that we talked about, getting better oxygen and just really avoiding those free radicals. And then the Retin-A or retinoids, as you mentioned, those are the ones that are helping to rebuild the foundation for that healthy skin to prevent the wrinkles in the future. Now, with the obviously sunscreen's over the counter, I'm assuming the vitamin C is as well. First of all, with this vitamin C serum, any untoward side effects to look out for, anything, or is it pretty innocuous?
Yeah, it is pretty innocuous. Some people rarely can have an allergy to vitamin C, but sometimes you can have a stinging, especially if you've been using a retinol. The retinol makes your skin sensitive to anything, even a moisturizer. And a lot of people think, oh, well, it's this vitamin C that's burning. But it's actually, if you're using the retin-A, it's probably the retin-A that's making you kind of sensitive to everything. So vitamin C, usually no side effects. Sunscreens, there's a lot of PAVA-free and non-chemical or physical sunscreens that you can use if you're worried about the chemicals. So those, and there's lots of sheer. There's Neutrogena Ultra Sheer that a lot of my male patients like because it goes on non-greasy, it doesn't feel like anything, and it doesn't leave a white residue. And then the retinols definitely have possible side effects. So because you're having a little mini peel, you can have burning, irritation, or redness. I use it kind of twice a week because I tend to have irritation. I'm a very lazy patient too. So I try to get it on, but sometimes I forget. And so I do get irritation, and a lot of patients do. It does go away over time, but you can counter that by moisturizing or mixing half and half of it with like your night cream or whatever moisturizer that you have, and that will help. But it definitely is very common to have the burning, irritation, peeling, redness from any of the retinols, the over-the-counter and the prescription.
And so again, having that redness, irritation is not necessarily a red flag, though.
No, that's totally normal.
Got it. And
Yeah.
when guys are in that pharmacy looking for that over-the-counter retinoid, is there anything they need to look out for or look for specifically? Because I'm sure there's like a bunch of them on the shelf. I'm not talking about a specific brand. I mean more like in terms of ingredients or anything that they should be looking for to make sure they get the right thing.
Yeah, I would look for something that has retinol in it. And then you can also get if you want a stronger kind of over-the-counter retinol, and that's definitely an anti-aging, anti-acne cream. It's different. That is a great over-the-counter, and that used to be only by prescription, but now it's offered over-the-counter. So I would recommend that one because that one's for sure a retinol that I trust, and that works great.
Got it. And so with these, we mentioned all of these are over the counter. So for prejuvenation, no prescription strength or, if you will, invasive procedures are technically required for true prejuvenation or prevention of wrinkle. Is that correct?
Well, if you're in the 30s and you're starting to see the lines, prejuvenation also can mean that you get a little Botox, and that prevents also the deep lines from forming. So now we're moving into the procedural prejuvenation area where you can have a few procedures and no one will know that you had anything done, but it definitely prevents those lines from forming over time.
And just to actually, I forgot to ask this question. It's a good time to ask it now. You pointed out a few areas of common for wrinkles, and I'm curious. For men, what are those main areas, and do they differ from women? Meaning that, obviously you get wrinkles in the same places, but do men typically seek help for wrinkles in different locations, or it's really all about the same?
I would say the number one area that men come in for is the forehead. Those horizontal lines really bother a lot of men.
You mean these right here?
It looks like you've been prejuvenating.
Well, thank you.
So yeah, the forehead lines are definitely the number one area. Women, I want to say, are here, and the crow's feet. For some reason, the glabella, and which is right the frown lines, and the crow's feet are less common of a complaint than the forehead, but I definitely, I do treat men in this area, and the crow's feet. Other areas that men don't like are the nasolabial folds and the marionettes. When they, as they age, these lines start to get deep, and just a little filler would help that area. But definitely the forehead, number one, moving down to the lower face. Now that we've been on Zoom and, working from home, tech neck is a big thing too for men.
Tech neck.
Tech
do
neck.
tell
Yeah.
do tell about tech
Yeah.
neck.
So it's the saggy skin on the neck. And many men come in and they want this, tightened a little bit. And we have very, very easy, relatively easy procedures to tighten that skin.
It's interesting. I actually recently read an article about this, that over the last year, with all of the Zoom calls, like men in the corporate space, and not only in tech, but anywhere really, there's so much more attention to their face and from the shoulders up, right? Because, when you're in person, you don't pay as much attention, but when you're looking at that same image over and over again, there's a lot more self-consciousness about this and a lot more attention paid to this. I'm sure you're kind of seeing that wave of patients who are kind of becoming cognizant of these kind of potential imperfections, because they're looking at themselves all day at Zoom and on Zoom, and they can't help it, right?
Right, exactly. Yeah, when you're face to face, you have no idea if there's a piece of spinach in your teeth and your neck is sagging. Yeah. So yeah, but with that little window where you can actually see what you look like, that people are coming in for that, for sure.
Makes sense. So we just spent a little time talking about, we're just making a trip to the pharmacy. We're really kind of dipping our toe in, but you know what? We've tried prejuvenation. We've reached me, we're in middle age now, and we got the real deal. And so we're really starting to see wrinkles. We're not just preventing them. We're going to see a dermatologist, right? We're past the point of over-the-counter remedies, internet sensations. We really want to get some help. Now, I want to start off with the least invasive. So I think that my first question is that you had mentioned also there's prescription strength creams and medications. Should I assume that that's the first least invasive step, or where do those prescription retinols, retinoids fit into your quiver of tools, if you will, for wrinkles?
So if you get the over-the-counter retinols, and they're just not, maybe you're not peeling anymore, you're not seeing as much glow into your skin, then or you're reaching your 30s or 40s and you want to see a dermatologist for prescription retin-A. We have different types of retinoic acids, and that those are prescription, and they're 10, 80, 100 times stronger than what you can get at over the counter. So that would be a prescription. You would usually see a dermatologist, and that will definitely pump up the volume of the peeling and the prevention of fine wrinkles. Again, a cream can only get you so far.
Right.
So a prescription retinol will definitely help. But if you're moving into that realm of, I need something a little bit stronger, then we would probably we'd give you a prescription for the retin-A or stronger. And then we would probably have a discussion, if you wanted, for injectables. So that would be the next step. And that's usually, Botox is our most common injectable. And Botox, there are 4 different types of Botox that are FDA approved in the United States. And they all have they're very similar. They're all botulinum toxin, which is a naturally occurring muscle relaxant. And when used in the right ways and injected by a physician, they can reduce the appearance of fine wrinkles, and also reduce those dynamic wrinkles that we were talking about. So when you're squinting or frowning or raising your eyebrows or smiling, it can definitely soften those looks, but you can still, if you are not over Botoxed, so you want to go to an experienced injector, you can have very natural results without looking kind of, frozen, like mask-like.
Yeah, that's important for sure. So a lot of questions about this. So number one, you had mentioned, so the mechanism by which this Botox works is it just kind of relaxes those muscles in, let's use my forehead as an example, and those lines. I want to get rid of these lines, right? So I went, Dr. Yun, you know what? I tried all the prejuvenation, not happening. I'm still getting the wrinkles. I want to get them treated. The idea is you're injecting around this area, and it's relaxing the muscles of my forehead to kind of allow this to soften. Is that about correct?
Exactly. And you're still allowed to express and, smile and raise your eyebrows, but you won't see those lines, those deep lines when you emote. So it's definitely a naturally occurring relaxant. But yes, it just kind of helps those muscles, and it's temporary. So if you don't like it, it goes away in, 3 to 4 months.
And so I'm going to ask you for these various truths, I'm going to ask you a lot of the same questions. Why? Because for the same reason we mentioned before, that most guys are often dragged into the doctor's office by their significant other because they have an innate concern about what's going to happen at the doctor's office. So simple question: how much does a Botox injection hurt? Is it on a scale of 1 to 10? What does it feel like?
It probably feels like a 7. Depending on how many areas you get injected. It's indicated for the upper face. So here, the forehead, so frown lines, so you won't be able to frown. Smile, the crow's feet will kind of soften. You'll still be able to smile. And then the forehead, the horizontal lines. It feels like little pinches. We use a 31 gauge needle, which is a very small, it feels like little, mosquito bites or in each area. Not bad, very tolerable.
Again, example, I know it varies person to person. Forehead, how many shots would I get on average?
Okay, I'm gonna have you raise your eyebrows. So right there so when Dr. Schwartz is raising his eyebrows, you can see those lines. Those will be ironed out, melt away.
Nice.
But you'll be able to still raise your eyebrows. So I would say probably around 8 to 10 little pinpoint shots, and they don't hurt. I mean, it's very, very tolerable. If I have a very nervous patient, I do have a numbing cream. It doesn't help that much, but it psychologically kind of is a placebo to help. But it really is tolerable.
Now, I've gotten my 8 to 10 shots. I leave your office. Does my forehead look like a checkerboard from all the injections?
No. The only restrictions that you would have is no exercising, because it can kind of migrate if you move your head up and down, and no naps. So I wouldn't go to sleep until you go to bed again, because it can theoretically migrate. We usually give you a little bit of ice if you do have any bumps, but in about 15 minutes, no one will know that you had anything done. Possible side effects are bruising. It does happen sometimes. We try to avoid we can kind of see the veins, but of course we can't see all of them. But possible side effects are bruising. With an inexperienced injector, you can have ptosis or eyelid drooping. So that would be somebody who doesn't know how to inject. I've never had any of my patients have that. And that's about it. And then just the pain of the injections. You can have headache, some people, because there is volume, a little bit of volume from the medicine in your forehead, you can have a little bit of a headache, but that usually goes away within 30 minutes.
And you said that you have a not fantastic outcome, worst case scenario, meaning that, something, it doesn't look quite to your liking, whatnot, or even, God forbid, the ptosis or which is the eye droop, that goes away in 3-4 months, right? Because that's
Exactly.
that's how long the Botox lasts.
Exactly. Yeah.
To the same extent, simple question: if you get treated with Botox, you should assume that you're going to be treated every 3 to 4 months, right? Because it's not a permanent one-time solution. Is that correct?
Exactly. So actually, if you keep up with it, you tend to go fewer times a year because your face starts to forget to make that frowny face. Or so I tend to have my patients who've been with me for 5 to 10 years only come like once or twice a year, because
Okay.
it's really maintenance at that point. So it is a good investment to get into, because again, you don't want to wake up at age 65 and realize, oh, I have all these wrinkles that I want to get rid of.
Got it. And you brought up a couple of points, a couple of times, the point of an experienced injector. When a guy goes to whoever, he's considering Botox already, or maybe whoever he goes to is recommending Botox, what are the questions that guy needs to ask, not about Botox itself, but about the person doing the injections?
So they should be a board certified physician.
Mm-hmm.
And I would say a dermatologist or a plastic surgeon, because that's what we do all day long. That's what we're trained to do. A lot of these medi spas have a board certified physician, but they may be an emergency room physician or an OBGYN or even a dentist, or a dental surgeon.
Yeah.
Or oral surgeon. So I especially for your first time,
Mm-hmm.
I would make sure that you go to a board certified physician, preferably a dermatologist or plastic surgeon, and also ask if they have any before and after photos, like a gallery. Look at their reviews. A lot of doctors have a love-hate relationship with the Yelp reviews.
Mm-hmm.
But if you see a lot of negative reviews or horror stories or botched cases, I would probably avoid that doctor. And then, go to somebody, your friend or your girlfriend or your boyfriend or, wife, husband has gone to. Obviously, if you like the results that you saw in your loved one, you can trust that doctor.
And for cancer surgery, for instance, one question that I always get asked is, how many of these have you done? And I always tell them, with you, it'll be the first, but just to make them feel better. But is that an important question to ask, or is it just kind of more in terms of outcome? Is there a magic number of Botox injections that the injector should have under his or her belt before you feel comfortable with them? Or is it just kind of more nuanced than that?
Yeah, I don't get asked that, maybe because it's not cancer,
Right.
right, that we're dealing with. I think they just assume that I've done a lot.
Right.
I don't know what the man meant. That's a good question. But I wouldn't, that's not a question I don't think I would ask a doctor. I would just assume that they have done a lot if they're doing it. Again, if it's your first time, avoid the medi spas. Avoid, going to maybe a PA or a nurse practitioner at your first time. Maybe after you've done it for a while. Any Groupons I would be aware, just wary of, because again, they're giving away for free for what reason? I don't know what. A lot of those Groupons, they're diluting it, or they're trying to teach somebody how to do it,
You get what you pay for.
There are also some vendors that are not in the States. So we, as in the United States, we're not allowed to use stuff from Canada or Europe, which is less expensive. So definitely, just if it's too good to be true, I would definitely stay away.
because it is too good to be true. In those cases, as most things are. So Botox gets the vast majority of the attention on social media and keeping up with the Kardashians and everything else, right? But there are other treatments for wrinkles as well that dermatologists can turn to. Can you talk a little bit about those and kind of, pros and cons?
Sure. So Botox is, it's fast, it's easy, isn't very painful. And you can go back to work that day. You can do it at lunchtime. So that's for the upper face. So wrinkles here, as I mentioned. But now we're talking about lower face or some other, when you start to get the lines through here and what we call marionette lines, when you start to have the kind of the jowls and the areas here that are concerning. And that's more for, 30 plus. Then you can start delving into fillers. Also, another area is as we age, there's gravity. So our skin loses kind of their elasticity and it starts to sag. And then we also, as we age, we lose kind of the fat pads of our face, the kind of the baby fat. So it starts to all move down. So when we can inject filler into the malar area, the cheek area, it can lift everything up, kind of get rid of these lines as well as the marionette lines. So filler is another way we can kind of fill in. So filler is hyaluronic acid or calcium hydroxyapatite. They're both naturally occurring brown substances that we make in our own skin, but we actually fill in these lines here, and also replace kind of like the baby fat that we used to have when we were 20 and 30.
Got it. So it's funny. I'm going to ask a question about fillers, but every time as you mention a new potential wrinkle, I'm looking at the Zoom and saying, "Hey, how does that fit in for me?" Sorry, you can't psychologically, you just can't help it.
I know it's a great, because it pertains to everyone. We're all aging every minute,
right? Yeah, I'm like marionettes. What's going on here? But with fillers. So first of all, just for the public knowledge, give me an example of a couple of names that people hear so they know what when they hear it, they know that's a filler. Like what?
Yeah. So Juvederm is probably the most common filler or popular filler. It's nice and soft. We use it in 30 to 60-year-olds. It can give you great soft looking results. And that's a hyaluronic acid filler. We have other fillers, Bellatero, Voluma, those are all Radiesse. Those are all different fillers Juvederm, Voluma, Restylane, Radiesse, Bellatero, those are our major 5 fillers. There are differences between each one, but essentially they all fill temporarily. So they all last from anywhere from 6 months to 2 years, depending on the filler. They fill in these lines, fill in the cheeks to lift them a little bit so that jowl down here kind of goes away. And so they're very safe. They're temporary. So if you don't like the result, they do go away. We do have, if you really don't like the result, which is very uncommon, we have Vitrace, which is a hyaluronic acid. It digests it. So it dissolves it. So if you don't like it, we can inject that. I definitely use that in patients who've come to me who've had, a filler at a Medi Spa and they need it to go away.
Got it.
We can also fill in, this is a very common area now in the last 10 years, we can fill in these grooves. A lot of men are coming in for the sags, the bags under the eyes, the saggy eye, bags, and the groove that you see here in aging skin, because everything starts to drop. So we can definitely put a little hyaluronic acid filler in that area, and it kind of makes it more, plump.
Got it. And is the experience with fillers the same as you had described both? As by experience, I mean quick little injection, doesn't hurt too much. You can go right back to work, not much in terms of recovery. Same idea, more involved. What would you say?
Because it is going deeper into the skin, and usually there tends to be a little bit more, uh, fewer injection points, and you're actually getting product, into the skin. So the actual volume of the product can burn a little bit more. I would say if Botox was a 7, it might be an 8 or 9 in terms of pain. And I'm talking about the average male scale,
Right.
because
Different scale.
you guys don't have babies, so I
Right.
tend to hold my hand, my male patients' hands a little bit more gently.
Understandable. Understandable.
And so anyway, yeah, it is a little bit more painful. And it takes me a little bit longer because we have to make sure everything looks right and filled in nicely. The risk for bruising is a little bit increased with filler. So, in my female patients, I say you can put concealer on, and now man makeup is more common. So, but there is more risk of bruising. And so that would be like a little bruise like here and here. But again, that goes away within like 3 to 7 days.
Got it. And then, one thing that, people have concerns about is, you're, as opposed to the Botox, like you said, there's actually there's a substance, there's a compound that's going to be sitting there. People have, remember the nightmares with breast implants leaking and the reactions that women had. Have you heard anything like that with fillers? Do people have allergic reactions to this? Did things like start developing in there? Anything like that you've heard or seen?
No, I mean, it's synthetic. It's not made from any cows or sheep, so it doesn't. There's no allergic reaction. There is a reported with the some of the Volbella Voluma products. There's a by cross reaction where they think it's not an allergy per se, but a hypersensitivity reaction, like 3 months down the line, where you get kind of not an allergy, but a reaction to the hyaluronic acid. But that's very rare. And it can be, and it goes away within a month or so. But that's the only kind of rare reaction that I've seen. Yeah, but they all get dissolved over time by your body. So they're very safe. It's not like they sit there forever, like silicone breast implants,
Right, right.
So,
and I'm assuming same rules apply in terms of determining, who to go to. Same idea, I mean, it seems even more at stake there. So you definitely want to use the same caution that you mentioned with the Botox, I'm assuming.
exactly. So even more so with fillers, because you can deliver a little bolus of product in some arteries around the angular artery, around the nose, that can cause a big ulcer here. I've seen inexperienced inject that. Also, rarely, and it's not indicated for the upper face, if you have an inexperienced injector inject around the eyes or the forehead, it can cause blindness. So that is, you want to go to somebody who knows what they're doing for filler, because the risk for adverse events is much higher with filler, because it's a product going into an artery. That would be the worst, scenario.
Certainly. So we've heard some great things about Botox up here and filler down here. What other options are available?
So if you have, again, the tech neck, the Zoom neck, we have tightening treatments. We have radio frequency. That's the new thing of lots of social media kids. And that's also kind of part of prejuvenation. It helps with kind of any kids with acne scars or large pores. This is the newest kid on the block. Radio frequency treatment. So it's radio frequency microneedling and radio frequency devices like Thermage. So Thermage was developed in the 2000s, and it's radio frequency energy going into the deep tissues. So radio frequency we're basically just heating up the dermis, melting the collagen, so it has to rebuild. So we're basically inciting wounds under the skin. And when you heat up the collagen, any acne scars, so the epidermis is going up and down for pock marks or ice pick scars or boxcar scars. The dermis has that scar tissue, but when you melt it, it rebuilds it, so the epidermis is now straight. So you have you have smoother skin, fewer large pores, and it can also improve tightening. So radio frequency is great for sagging skin, tightening, acne scars, and stretch marks, and reducing pore size. So those are the new treatments for that.
So for that radio frequency, so basically the wrinkles here, not so much. Is that correct? Unless they're like scar stuff or
it can. If you do microneedling too, it definitely, radio frequency microneedling, it can improve like the fine lines, and then the crepey skin under the eyes. Those are kind of wrinkles too, but it can definitely tighten that area so it looks smoother instead of crepey. A lot of men and women have the complaint of crepiness underneath their eyes. The skin just gets thin there, and the sun has been, beating upon it for 40, 50 years, and they want to improve the look of that.
Got it. And then how many treatments do you get? How does those treatments work? It's also like every few months?
You usually need 3 to 5 treatments, and we apply a numbing cream, and it is, it's very tolerable. And you might have a little bit of redness for 3 to 5 days afterward. Yeah,
and
a lot of our, I'm sorry.
Sorry about that. How long is the effect for? Also a few months, or?
Yeah, more than a few months. It can, as long as you keep up with it, maybe do 1 treatment every year. So you'll do the treatments for the first year, 3 to 5 treatments about a month apart. You can definitely keep up the results for your lifetime. You might need a touch up every year.
Got it. So another thing I hear a lot about whenever you go to dermatologist, there's always a laser involved. So are there laser treatments for wrinkles, and how do they fall into all the other options?
Yeah, so we have intense pulse light, IPL, which is like a photofacial. It can definitely help find wrinkles. It also is a light that is kind of a wide range, so it can target hemoglobin. So a lot of men are seeing a lot of telangiectasias or broken blood vessels around their nose and their cheeks. They say, this makes me look old. This makes me look like I have like an alcoholic face. I need a treatment for this. So IPL is a great treatment for these broken capillaries all around the nose. And it's intense pulse light. So it's basically a light that targets that hemoglobin, the red blood cells. It can also target melanin. So if you have those sunspots, it can also hit those too. So we call it the reds and the browns. IPL treats the reds and the browns and the fine wrinkles. And basically we treat the face or any, just the nose and the cheeks, wherever the area is affected. And it feels like little rubber bands. We protect your eyes with goggles, and it feels like little rubber bands. You could again have, redness, swelling for about 3 to 5 days. And as I said, with any procedure, you want to avoid the sun for about a month afterward. Yeah. So a lot of these patients are coming in for the laser treatments during the winter. So they don't have to avoid the sun during the summer. And then there is major laser resurfacing, and I would reserve those like our fractional CO2 lasers. We have Opus, which is a radio frequency resurfacing laser, and those basically shed, your whole skin is melted away. And if you can
That
imagine,
sounds very pleasant.
so yeah, our fractional lasers can melt away the top layer of the skin and treat the lower layer at the same time. So you're remodeling the collagen, you're getting baby new skin. So obviously your skin kind of sheds. You have peeling, redness, and the downtime for the resurfacing lasers is more like 5 to 10 days. And it depends on which laser you choose, but some patients look, pretty red and peely for those 5 to 10 days. And we always numb you up. It's a little bit, it's probably a 7 to 8 in terms of uncomfortable pain.
And so that's reserved for the really severe type of, like, it's a big weapon you're using there, right? Not just
exactly
Botox.
That's not pre-rejuvenation. That is let's erase 60 years of sun, biking and swimming. Yeah.
But it's effective though.
Yes, it's great. It's great. Yeah, those are our big guns.
Yeah. Is there, I mean, aside from the discomfort and the healing, are there any significant risks to that, like long-term, that people have to worry about?
Yeah, well, not long-term, but again, if you're with an inexperienced physician, you can have hyperpigmentation, scarring, and some of that can be very, very serious. Burns, obviously. And so you want to make sure you trust the person that you're going to make sure they're board certified, and look at their before and afters, read their reviews online.
Right. So I think that really the take home message from that standpoint is just that, like, really like the meta spas and the kind of walk in, just whoever regardless of the wrinkle treatment, there is no kind of free lunch where it's just kind of some, people make out these treatments to be just kind of like, oh, over lunch, I'm just going to go and have a martini and get this done. But they have consequences, and you really have to go with somebody you trust, by the sound of things. I mean, this is not something to be taken. It's not like, what is it called? Going to dry bar and getting your hair blown out and stuff. There's a lot more on the line here than that. That's for sure. Right.
Exactly. Yeah, there are definitely risks to this, any of these procedures, but they can be minimized if you go to the right person.
Got it. And there's also a lot of choices to be made by the looks of things, versus fillers, versus injectables, versus the laser or the IPL or the radio frequency and whatnot. How do I phrase this correctly? Do guys mostly come in saying, I want Botox done for this? Or is it more, would you recommend more, if I'm a guy and I'm looking in the mirror and I'm saying, well, I'm kind of worried of my wrinkles, just to go on dermatologist, have them take a look and kind of give you the recommendations in terms of kind of what the best options are?
Yeah, I mean, at this point, because it is becoming more popular in male patients, I do see them saying, listen, I don't know what I need, but I need something. Right. Everybody is younger around me, and I just feel like I need to just zhuzh up my looks.
Love that.
Yeah. So yeah, a lot of it, I want to say most male patients do not know what they want. They just say, I have these brown spots. They don't know. They don't do the Dr. Google as much as women do, I want to say, in terms of cosmetics. They say, how do I get rid of these? And you want to go to somebody who's experienced, who knows, this patient is a good candidate for IPL. This patient needs filler, and that's it. You want to have a whole menu of services that from an experienced person who's, they know, okay, this patient needs this or this, they don't need this, right. And we don't want to sell you anything, that you don't need.
That is such a good point.
Yeah.
You can't, if you go to if you go to a hammer that only sees one type of nail, you're only going to get that, right? And that may not be right for you. And so that can't stress that enough, right? Because you just need somebody who has everything, a professional who has all of these tools at their disposal and know what the right one is for you. I mean, that goes across any type of treatment for sure, and such good advice to the guys out there. One last question for you: when does the real hardcore plastic surgery come in when it comes to wrinkles, or does it? Like you had mentioned facelifts a while back and stuff. When does that even come into play these days, or does it?
Well, I would say if I tell my patients, obviously, my honest opinion if they ask. And I think our patients respect my partner and me because, we don't try to sell things that, that don't work.
Right.
Or the patient needs a blepharoplasty or an eyelid lift.
Mhm.
And we know we can't correct that with Botox or lasers or filler. We will say you need to see a plastic surgeon to get your eyelids, take tissue from here and here. I'm not obviously an expert at that, but I do know when to refer. Also, if they are looking to lift, their jowls way too far than what I can do with filler or a thread lift, I would say, or even the double chin is a major thing that men come in for me to see me about. There are things that I can do, the radio frequency microneedling to tighten a little bit, but again, it's not a facelift, and I will refer them to a plastic surgeon if they need liposuction or a facelift to pull all of this up, or a blepharoplasty, the eyelid surgery.
Well, that's actually great advice. Again, that also goes into the idea of, a hammer looking for a nail, right? If you don't want to spend months and a lot of money on procedures that won't benefit you long term, and you need somebody to professionally be able to give you their honest opinion and say, you know what, as much as I'd love to do these procedures as a practitioner, they're just not going to work for you specifically, and you may need something more aggressive. And that's so important because, again, this is insurance doesn't cover most or all of this. This is out of pocket. It's a big investment. It's an important investment. It's an investment in one's self-esteem and one's well-being. But it's an investment that should be done like any other investment, intelligently, right? And doing your homework. And I think you've really helped us quite a great deal today in terms of doing that homework and understanding kind of the questions to ask and really what to look for when you're looking in the mirror, as I've been doing on the Zoom call over and over again, and noticing all kinds of things that you brought up that I'm like, but really a lot of great food for thought. So I'm gonna round up with asking a question completely unrelated to dermatology or skincare. This is called Better Man Clinics, and the real foundational point of this whole process is for men just to get better. So a question I like to ask all my experts, and all my experts have obviously achieved a tremendous level of success in their lives, personally and professionally. What is the key to living your best life? No pressure.
Well, I've learned from the pandemic and, the years of medical school residency, fellowship, you need to just be grateful. Be grateful for your family and your friends and being alive, really. We take it for, I just had an outdoor pool party for my son yesterday. And it was the first time, we've had a party in 2 years, and I have seen some of my family members, and I'm just grateful to be here, and we made it out safe. And I know, for hundreds of thousands of Americans, they can't say that. So I'm just grateful to be here. And I think that's the key to anybody's success, to in the morning, think of 3 things that you're grateful for. And I think your days will all be great after that.
Well, that's such a good point. Actually, I saw a study a couple of years ago where they analyzed the keys to happiness, and they looked at dozens and dozens of things, everything from money to family to religion to you name it, right? And the one element that came up way above, head and shoulders above everything else, is gratitude. was the key to happiness. So what a better, can't think of a better way to end this particular episode. Dr. Yun, thank you so much for providing us all of this insight. Would love to have you again. I'm sure there's lots of topics guys would love to hear about from you. And to all our listeners out there, just remember that your best self is a journey and not a destination, and use every day to get just a little better. Thank you, and please join us next time.